Ooh, you feel that? That's it.
Yeah.
Oh.
So when people, and this is general, like I'm going to use the elbow as an example, but it's common like this across the body. It's like if people are having problems, especially with their joints, I start looking at all the muscles across the joint and then working the soft tissue across the joint can do like, man, you can almost feel like, just to use a finger as an example, like they can have pain in their knuckle, but it's like the muscles are like jamming it on one side, like it's always tight or something, kind of holding it off. But I'll find that with like shoulders, elbows, hips, knees, all the time. But going in and just like lightly working, really the antecubital space, like right here, you want to put deep pressure in there, especially as a novice. You'd have to do more like anatomy research, but like this light kind of jostle, kind of grabbing above and below. Like all these forearm extensors up here and then down over here. A lot of times, even with all my study, like I have to go back and look at anatomy charts because I'll get lost.
Yeah.
Or like somebody will have a problem I've not specifically had because they're hanging sheetrock or, engaging their body in a slightly different way that I'm familiar with. Too much in there?
Oh. You know how you were saying that, new therapists are like, well, what do I do? I think part of the problem is they just don't have enough tools in their shed yet, It's like as you get more, as you like keep taking more classes and keep studying, you end up having this treasure chest full of tools, and then it's like you start to kind of figure out where to apply those and what to do. But like straight coming out of school, you don't really have like, woo-hoo! You have just like such basic knowledge that it's hard to think outside the box.
The other thing is if their training isn't really good, like somebody will have elbow pain and they're like, well, I can't press on anything in the elbow, but it's like. But
they're not thinking about the big picture of the structure.
The thing is, they're not necessarily taught in a 500-hour curriculum, but like it's almost impossible to teach them that quickly.
Yeah.
Like that's where they go to continuing education. But a lot of times if they're having problems with the joint, again, I'm going to look above and below. Yeah. And when I say that, I mean I'm every muscle. Like sometimes you have to exhaustively go through them to help the client figure out what's going on.
Yeah.
And I've never had clients get mad at me because I didn't figure something out in one session.
Yeah.
Because sometimes I don't know. Like I've worked on people and it's like they're having knee pain and it's their popliteus, which is that muscle right behind the knee. And I have to go in and look at the anatomy chart and go, okay. And then very carefully go in and go right in there. And they're like, oh, and like, is that your knee pain? And they're like, yeah. But it feels exactly like it. That referred pain pattern. Yeah. But you have to be careful just at pressure on nerves. And usually if you're too sharp, too fast, too deep, or some combination of those is where injury comes from.
Yeah.
If you'll communicate with the person, they'll let you know how hard you can press right there. Because I can see your demeanor change as I'm like, oh, it's dense right there. What's that? Oh,
it's pain.
Yeah, it's pain.
It's death.
It's paining. It's paining.
Oh.
But a lot of people, like with their tricep, I think my tricep, this left arm in particular, tricep feeds up into my shoulder blade. Some shoulder stuff I got going. And then bicep. Not too much right there?
No.
Okay. Feels good?
Whee!
Whee!
Yeah, I mean, good. Feels intense as heck.
Okay, so if I'm right there, is that too much?
No.
Okay. And that's right on your bicep. Too much? Can you gently, can you kind of bend at the elbow? A state of all fuck has been declared.
Every time you ask me to move, I'm like, yes. I can move.
So on me, this is what I notice. I got a few gnarly areas. Like you really started to get into my hip the other day. Like what felt like for the first time somebody got in and was like, wow, I don't think it's just my TFL. I think it is a piece of my quad.
Yeah.
But it's like you had to slowly work your way through. And sometimes if I've got an old injury, not only does the tissue not feel pliable, I tell people when somebody presses on it, it feels like I'm getting prison shanked. Like it's so like
sharp.
the tissue is so dense and tight that when you press on it, there's no give. It's just like, ooh, would you stop like hurting me? Like, because but if they sit and hang out very broad, it'll start to soften and just But I think it's just feeding back through their nervous system. There you go. But that little rotation, see, I didn't have to tell you to do that. You just start going, right there, right there, right there.
Because it feels good. Like
pronator teres. And then the bicep, tricep, across the elbow joint, right? Yeah.
It's intense. I mean, like, I know I'm tight, but like, I didn't know it was up there too.
Well, it's also why we continue to work together in an ongoing way.
Yeah.
You know, it's like bodies are... I've been in a lot of pain. A lot. And I'm really good at working on it. And I have a penchant for it because of that. But I've also helped myself out of so much pain that it's made me really good at what I do. Like without that pain, I don't think I'd have the same like emotional and psychological set to be able to help people in chronic pain. In fact, I can't even imagine not being in chronic pain at some point and working on people in chronic pain all the time.
Because you wouldn't really have any understanding of what they're going through.
Yeah, it's like if you're a doctor and you've had a hip replacement, you're like, oh, well, let me tell you about my hip. Like, and they trust you immediately because of that. And a lot of mine is just musculoskeletal. You know, it's not permanent injury. It's not herniations or bulges. Just right where my thumb is.
Yeah.
The underside right there.
It's fire.
Fire, fire, fire.
Fire in a bad way, but in a good way, you know?
If I bring it up right here, just to expose that. How's that right there?
Good. Oh.
So if I shear like down towards your feet or up towards your head. Which one?
What?
What?
Down towards my feet or up towards my head?
Mm-hmm. Down towards your feet, up towards your head. Right there? Yeah. Okay, now. Now if I rotate you up or down?
Up.
Up.
Oh. Oh. Wow. Whew.
Too much?
Nope.
No referred pain?
No.
Just localized?
Just local.
Yeah. Well, you just use all this stuff so much. It's like, you know, I mean, essentially you're doing manual therapy, you know, manual labor. It's like people don't think of massage as being all that physically intense, but it's like go lay tile for 8 hours a day and see what happens. You know, go hang sheetrock.
Yeah.
Do repetitive stuff. Is it okay across your wrist?
Yeah, it's fine.